Okay, I've shown you a lot of rotator cuff work in the past, but today is about eccentric tendon training with bands, because I got asked the other day, how do I do eccentric training for external rotation, internal rotation, that sort of thing. So today's dedicated to that. And I like using bands the most for this. You can use dumbbells for concentric training, but when it comes down to eccentric training, it's about how to get it done and the easiest way of doing it so you actually get it done. Using bands is the best for that. So anything like this sort of thing, I use tubing, so rather than the flat bands, because it goes around poles and things like that better. Remember, universal standard, yellow is usually the lightest, so if you're doing eccentric training, probably start with the light ones rather than the heavy ones. You can always build to heavier stuff like the red and the green later. Start with an easy one. Now, I'm going to go through external and internal abduction today and showing you with bands. The trick is making sure that when you do the eccentric phase, that's the loaded phase. Okay, the concentric phase, which is if you're doing external rotation, that's the concentric phase, that needs to be unloaded or hardly any load. So what you're trying to do is just work the tendon on the eccentric phase. Now this is usually when someone's either injured, they're a bit sore, a bit weak, or they're post-surgical, and then that phase where we don't really want to load the tendon too much, maybe it can't handle it, so we want to be light on it, but we still want some strengthening, and so we can sneak in strengthening using the eccentric component. That's when the tendon and the muscle is contracted and then decontracts through range. So just think eccentric, decontracting through range. So I'll show you the concentric one. So if I'm doing a standard external rotation down at 0 degrees in neutral, concentric phase is that. So I'm doing external rotation, so I'm using my rotator cuff here sort of at the back mostly, a little bit at the top, by contracting the tendon and the muscle and shortening as I go through range. So saying that shortening through range. So the eccentric part is the lengthening and decontraction through range. So when I do external rotation, it's from here, going from external to internal. So the trick is, use the other hand to take that out. So I basically take the slack off the band. There's the unload. So I just then position my hand out to get to wherever my external rotation position I want to be in. If that's full range, I've got full range there. Then you put the load on by letting that go slowly, letting that go. That slowly loads the shoulder. And now I'm in an isometric position here. And then I simply wind that back. Now the rep range or the tempo range should be about 3 seconds to 4 seconds on the way back. So you can put it out as fast as you like, as long as there's no load here. Get it in position. Make sure that elbow's not tucked in by your side. Just get it out there. Put the load on slowly. Hold it for a second or so, and then 3, 2, 1, 0, like that. Okay, and obviously making sure your form is right with not rolling your scapula forward, that sort of thing. So if I was doing that external rotation, that's your 0 degrees. If you wanted to go 45 and 90, you just change position, but do the same thing with this hand. So if I want to do 45 degrees, which I like the most, I'll then rotate in 45 degrees. I've got to use this hand, take the slack off. See, it's gone all loose. Get my hand in position. So then when I get out to that external rotation position there, then put the load on, I've got to be able to resist that. So this is the trick. If you let that go and your hand rolls in, the band's too heavy, you're not strong enough. So you've got to make sure you can have a really good isometric contraction at that point. Hold it, feel it there, and then roll it forward as you're sort of increasing the length, okay? You're going through that eccentric phase. You grab it, return, back to there, on, roll it forward. Now, the thing about eccentric training is it takes a lot of effort and the reps sort of seem a bit longer. You don't feel like you're getting as much of a workout. But for those people who need that sort of bridging gap between isometric or doing nothing with movement to then full concentric eccentric load, that eccentric phase is really, really good. So that would be your external stuff. And of course, you can go to 90. The internal one is pretty hard because what you've got to try and do is if I'm going internally like that, how do I pull it in? Okay, so the best thing to do, and this gets sort of the point where you're getting it's harder and harder to do for the patient, but it's still worth it. This would only be, say, if you've had a subscap major tear or you've had surgery for that where you're just so weak you can't even pull it in. What you do is you turn and face the band and grab it and pull it like that. Okay, so I'm in internal rotation. Then I put my load on and then I wind it back. Okay, so it takes a lot longer to do. So because I can't pull it in, if I don't have enough strength here or it hurts a little bit to do that, and I just want to do eccentric, rotate in or just grab the band, haul it out, get position, put it back on, and then there's your sort of lengthening phase where you're decontracting through range. The trick is not to forget, don't just go and put it again. You've got to go, okay, I've got to go grab it, pull it back, put it on. So that movement is, it can be fast. It's that movement needs to be slow, that 3 or 4 seconds. Grab it, pull it back, put it on, and away you go. So there's a bit of setup with that. Same if you want up to go at 45 degrees. And if you're going 45 degrees with internal, maybe just raise it up a little bit higher to there, okay? So if I'm going to that position, I have to sort of reach around, grab it, pull it forward, get myself in position there. And I just got to angle it so it's just off my forearm, and then wind it back through that range there. Now, at this point, you have to reach over or turn around, like just let it go, come back. Don't let it go fully because you still want some tension on there. So when you're going backwards this way and you get to that end range, don't just sort of let it go and turn it off, okay? Get to the point where you've still got some tension there, grab it and pull it forward. Get yourself back in position. Can you see how it takes a little bit of time? But for a lot of people, it's totally worth it. So there's your internal. Now, abduction, again, that's working on directly on some supraspinatus work, is so important for those people who have had a supraspinatus repair, especially in that early stages of surgery. So if I show you this way, I want that band sort of around about down by my hip. If it's too high, there's not enough sort of load from coming down the bottom because I'm going to be lifting up. So if I get to there, if it's too high, there's not much load. I would put that down a little bit further, maybe hip or knee height, okay? When you get stronger, it can go right down to the floor. Now, obviously with concentric, is out and down. So we don't want to do the pull out part. So just like the external, what I would do, grab it, slacken it off, get it out there. Now, if you're doing eccentric training, there's no point going to 90 degrees with this because your shoulder blade is going to start moving. We want to actually have the shoulder blade stable, so aim for 60 degrees with that, okay? Get to that 60 degrees mark, meaning 60 degrees, not 90 degrees, so down at 60 degrees. And then have the tension on, hold it there for the isometric, and then do that 3 or 4 second drop where you're decontracting. So think of that tendon up in here and your deltoid. If you go up in this position, it's now in a shortened, contracted position. And then as I lower that, it's lengthening and decontracting, okay? It's much easier for a tendon to hold and release, same with the muscle, than to contract on the way up, okay? You need a lot more strength there. So if you're someone who has got a low level of strength, whether it be from injury, a tear or surgery, or massive tendinopathy, this is the best entry level stuff to do because you can handle the deload. And if that's a bit painful, then you slacken off the load, okay? If you get to the point, some people I've got who are so weak because they've got a really big tear, maybe they're, they can't have surgery or they've had a big surgery and they're really, really weak. What they can do is deload on the way down with external, internal abduction. So if I went completely in a zero load, just my arm, put the load on, if this band was even a yellow, was too hard, and so when I come down, it's like, oh, that's too much load, I can then take a little bit of load off that band there, see that? So as I go down, I'm deloading with this arm. And that's a nice little trick. If you're at that point where you're really stuck, then you have zero coming out, you've got more than your arm. So think of like, if I can do that, okay, and there's no load, that's just my body weight. If I want to put load on, I just put it sort of maybe start off with half, okay? So if that's a full load on the way down, 100%, take off some of it. And so when you come down, there's just less load. And then you can graduate it. As you improve, you can do less and less and less here, so that eventually gets to the point where it's like maybe 10 or 20% on the way down. And then over the weeks, you can go, you know what? I can take that off and I can go all the way down by myself. So this one, try and stay, well, I would want people to stay completely pain-free with this. There's no point of if you've got a weak tendon, putting lots of pain through it, it's probably not going to strengthen up. So try and graduate how much load you put here eccentrically to make sure it's pain-free. So there's my external, internal abduction. I hope that helps. See you next time.